Hello everyone, and thank you for coming here today. This contract announcement is different than every other contract announcement you'll sit through because I think doctors have done something that is truly unique. I'm pleased to share the news with you that 82% of doctors who voted agreed to amend their master agreement to help improve the province's financial state. Doctors understand the province's economy is struggling, and we want to be leaders in improving our healthcare system. We're willing to do our part to help reduce healthcare spending. What this means for doctors is that we've agreed to receive a 1% increase in each of the next 2 years of our contract, similar to what other professionals are expected to receive. The current contract provided physicians a 4% increase in each of the next 2 years. These increases will be deferred until 2013 and 2014. Physicians will be saving the province an estimated $45 million over the next 2 years with these amendments. You may be wondering why we'd agree to amend our contract. We did it to protect programs that are important to patients and doctors. When Health and Wellness Minister Maureen MacDonald approached Doctors Nova Scotia about revisiting our contract, we had concerns that this could negatively affect the programs that had just begun to impact patient care. It was from this point of view that we decided to help governments save money while securing funding for programs that are important to physicians and our patients. We all know the challenges facing our healthcare system, and this is our way of making an immediate contribution to finding a solution. By becoming part of a solution, we are more likely to protect important programs. When we negotiated our contract in 2008, we were proud that we had negotiated a contract that was innovative and patient-centered. For the first time, money was provided to support system change. For example, there were incentive programs to encourage physicians to have more evening office hours. This contract was a step away from the norm. Historically, through the country, funding increases were tied to the Master Service Unit, or the MSU, instead of incentive funding. In simple terms, the more patients you saw, the more money you made. Clearly, in some cases, this is not the best system for patients, especially those who require more time and more attention. This agreement made strides in changing payment methods to allow care to be delivered differently. The amendments we have just agreed to will help ensure that these innovations made in our contract are protected. For example, our agreement supports comprehensive care through encouraging family physicians to provide a breadth of services for our patients. These include visits to nursing homes, hospital care, obstetrical care, house calls, care for children under the age of 2, maternity visits. Our contract also supports the treatment of chronic diseases, an issue that's on the rise in our province, and provides incentives for rural specialists to stay in communities. From talking with my colleagues leading up to the referendum, many expressed support for the amendments to our contract as a way to preserve important patient-centered programs. As I wrap up, I want to acknowledge this was a very difficult decision for many of my colleagues, even those who voted to support the amendments. Many doctors expressed concern to me that they had reservations about government's intent to retract funding already committed to in a contract. As we move forward with the amended contract, we expect there will be no other changes and that government will see this contract through. Once again, I'm very pleased to share this news with you, and I'm proud to be part of a medical community that has the forward-thinking and open-mindedness to make decisions that benefit our patients, our communities, and us. Thank you.